Hello and welcome to another episode of Desi Table Talk. This is your host, Dr. Desi, with another interesting topic to discuss today. So please subscribe to our channel, like it, share it, and push the bell icon so you get notified whenever we post a new video. So as we start today's show, I would like to add that this does not make us or put us in a doctor-patient relationship, and this show is purely an informational show and does not intend to provide any medical advice or to give you any treatment or provide you with any treatment. If you do have any specific concerns about your health, you should consult with your own primary care doctor. Our show today is regarding diabetes and Ramadan. As you all know, Ramadan is fast approaching, and there have been lots of questions and queries from folks regarding their treatment of diabetes during Ramadan. So we will be discussing that today, and I will be providing you with some general information regarding diabetes during fasting. According to the 2019 population estimates, there are about 109 billion Muslims on this planet, and because diabetes is prevalent in about 9.1% of the total population, the estimated Muslims who fast comes to about 112 million folks. Key to successful diabetes management during fasting or Ramadan is aimed towards two factors. One is to prevent any problems from fasting or prevent any problems or creation of any acute complications due to fasting, and also to prevent any deterioration of the glycemic control. So if somebody has a well-controlled diabetes, the goal should be to prevent that. So when it comes to fasting during Ramadan for folks who have diabetes, there are two important factors to keep in mind. One is a pre-Ramadan assessment, which is very essential, and for that, folks who have their own primary care doctors should make an appointment with their doctors or call them and speak to them regarding management during Ramadan. And the second factor is how to control or to manage your diabetes while you're fasting. So some of the things that make fasting difficult during Ramadan for folks who have diabetes and are contraindications to fasting include severe hypoglycemia. Hypoglycemia is low blood sugar. So severe hypoglycemia within 3 months of Ramadan. Number two, hyperglycemia. Hyperglycemia meaning high blood sugar, which averages more than 300 milligram, or an A1C level of 10% or more, both of which signifies that your sugars are not well controlled and are contraindication for you to fast. Number three, if you have recurrent episodes of low blood sugar or hypoglycemia, or you have a situation where you can have low blood sugar but not feel it or not have any reaction. Most folks who have low blood sugar will experience symptoms of low sugar and they would know, but then there are a few patients who are unaware of low blood sugar reaction, and they should also not be fasting. Number four, diabetic ketoacidosis within 3 months prior to Ramadan. Diabetic ketoacidosis is a medical emergency where your sugars are extremely high and create an acidotic blood or serum. So if anybody who has had a DKA within 3 months of Ramadan should not fast either. Number 5, any acute illness like pneumonia, upper respiratory infection, any heart or kidney disease, which a person acutely has with diabetes, should avoid fasting as well. Number 6, anybody who is engaged in physical labor, whose job is such that they are physically extremely active at work, should also avoid fasting if they have diabetes, because that can cause their sugars to drop very low. Number 7, of course, if somebody is pregnant and has diabetes, they should avoid fasting as well. And number 8, anybody who has chronic kidney disease or is on dialysis should also avoid fasting during Ramadan if they are diabetic. So the other important thing is managing the diabetes during Ramadan if you're fasting. And one of the misconceptions that has been there is that if you check your blood glucose while you're fasting, it breaks your fast, which is not necessarily true. And so if you have diabetes and you're fasting, you should really be checking your sugars more frequently than if you were not fasting. And this will give you an idea if your sugar is running too low, and if it is running dangerously close to a lower level, you may be able to either discontinue the fast or break the fast. The other important thing during Ramadan, when it comes to breaking the fast, the most important thing is traditionally Muslims will break fast with dates, and with diabetics, dates are not contraindicated, but as with any other nutrition or diet, the most important thing is that one should be careful with portion control. And if you do want to break your fast with dates, you should not consume more than 2 or 3 dates at any given day. Then the other food items to be mindful of is, just because you had been fasting all day long does not mean when you break the fast you indulge in food that you should not ordinarily be eating, like food which is high in carbohydrate or high in sugar content along with fat. So you should generally still be watching what you ordinarily would be watching because of diabetes, but just because you have fasted does not mean that you should not watch your portions or be indulging in foods that you ordinarily should not be. And the other most important thing is stay well hydrated. So as much water that you can drink after you break the fast and throughout the evening and overnight before suhoor, you should try to stay well hydrated, because that's the most important thing when it comes to diabetes as well. So this was just a very brief introduction to diabetes during Ramadan for folks who have diabetes and who want to fast. But again, I'm not a religious scholar and I am not your doctor. So please consult with your religious scholar and your doctor if you have any specific questions regarding your specific diabetic issues. This was just a general account of what you should be doing and what you should be watching. But the most important thing is, before Ramadan, you should contact your doctor, come up with a game plan, and your doctor would know if your diabetes is well controlled or not well controlled based on your A1C levels and based on how frequently they have to increase or add medication to your diabetic regimen. So the best thing would be to discuss this with your doctor before you start fasting. And also, if you have any questions about various issues that can lead to nullifying of the fast or breaking of the fast, you should also consult with your religious scholar. Again, with that, I would end the show, and I would like you to subscribe to our show, share it and like it, and please hit the bell icon so when you get the notification when we post a new video online. So again, take care of yourself and stay well and stay healthy, and happy Ramadan.